Welcome back to the NHSC
Site application process. Today, we're going to discuss comprehensive primary care. As always, everything we talk about today can be found on the HRSA's website through the National Health Service Corp section, and everything I reference can be found in the NHSC Site Reference Guide. So make sure you are reading the NHSC Site Reference Guide before filling out an NHSC site application. So your site must provide comprehensive primary care, meaning medical, dental, and/or mental behavioral services, which corresponds to its designated HIPSA type. So the NHSC defines comprehensive primary care as continuum of care, not focused or limited to gender identity, organ system, a particular illness, or categorical population. So your site must also function as part of a system of care that either offers or ensures access to ancillary, inpatient, and specialty referrals. With the exception of substance use disorder treatment facilities, if your site does not offer all primary care services, it must provide an appropriate set of primary care services necessary for the community or populations you serve. So example would be if a site serves a senior population, it must provide geriatric primary care services. So what you'll have to submit for documentation for the NHSC site application for primary comprehensive services is either signed memorandums of understanding, signed memorandums of agreement, signed contracts, or any formal referral agreements. And if in a formal referral agreement does not exist, the site must provide a date and signed description of how it ensures patient access to ancillary inpatient and specialty care. So many organizations do have one of these type of documents, usually with a larger hospital or a specialized facility. So making sure you have those acceptable documents that you can submit to the NHSC site application. And again, if you don't, really making sure you have those signed contracts or memorandums of an understanding agreement with an organization before submitting your application. So who is exempt from this? FQHCs, FQHC lookalikes, Indian Health Service facilities, federal and state prisons, and ICE facilities. Again, don't need to submit, but with the asterisk, you do have to have some type of documentation on hand. So those memorandums of understanding, contract of some sort. So when there is a HRSA site visit or they request HRSA request, you can submit that information to them. But if your facility does not fall under any of the exempt facilities, then you are required to submit one of those forms documentations. As always, if you have any questions, feel free to email me.